This is what the American functional scientist Ronald Grisanti argued. In the case of carpal tunnel syndrome, you have to pay attention to it first. Nutrients are vitamin B6. But the important thing is, most of the time you have a carpal tunnel syndrome, a much higher B6 person who is biologically available in our body. It is highly likely that pyridoxal 5-phosphate should be used. Dr. John Ellis, a surgeon, said vitamin B6 could be used to detect carpal tunnel syndrome. I published quite a few papers on how to solve it. Many other doctors believe that B6 is effective in curing carpal tunnel syndrome. I've confirmed that there is usually necessary to resolve carpal tunnel syndrome. The amount of pyridoxal 5-phosphate is 50 mg per day. If you take it for a month or two, it will be effective. If you use it for about a month and it doesn't work at all, I know that vitamin B6 needs zinc to work in the body. It is necessary to remember, B6 cannot be activated in the absence of zinc. In other words, until the zinc deficiency problem is solved, it means that no matter how much you assist B6, it will be of no use. There is another fact that must be mentioned here. Plastic additives or phthalate are hard to figure out. It can prevent B6 from being used by causing zinc deficiency. Another reason why it doesn't work, even though it's a supplement to B6, is mercury, arsenic, lead, cadmium, and heavy metals such as aluminum. These heavy metals are essential minerals that act as catalysts for enzymes. All block you. As a result, it inhibits the action of B6, such as carpal tunnel syndrome. There are symptoms that seem completely irrelevant. Therefore, the patient's pyridoxal 5-phosphate is being tested by the carpal tunnel syndrome. If you use it for about a month and it doesn't work. Next step: zinc deficiency problem, plastic additives, phthalate accumulation problem, and we'll examine him in detail for heavy metal poisoning. And if there's a problem, if it is confirmed, we need to solve that problem first.